Hello, my name is Jamil Mushtaq and I'm a fourth year medical student, and today I'll be going over conjunctivitis, which is a really important topic within ophthalmology, which all medical students are expected to have some knowledge of. So the areas I'll cover in this podcast are the anatomy and physiology of the conjunctiva, the definition and importance of conjunctivitis, the types of conjunctivitis, and their treatment. So starting off with some basic anatomy and physiology, the conjunctiva is a thin membrane which covers the internal surface of the eyelid, then folds back on itself to cover the external surface of the eyeball up to the cornea. And these parts are called the palpebral, fornicule, and bulbar parts of the conjunctiva. I won't go into too much physiology, but simply put, the conjunctiva serves an important purpose as a physical barrier to infection. So if we go on to conjunctivitis, conjunctivitis is defined as inflammation of the conjunctiva and is colloquially known as pink eye. It's one of the most common conditions of the eye. However, it can have some really serious consequences, including blindness. In general, it causes generalized redness of the eye with some discharge. However, if there's reduced acuity or photophobia, this is suggestive of involvement of the cornea, which is called keratitis. So that's something always to look out for. Now, the main types of conjunctivitis are viral, bacterial, and allergic. In addition to this, there are some special niche types of conjunctivitis. These include herpes conjunctivitis, chlamydial and gonococcal, and also vernal keratoconjunctivitis, which is a type of allergic conjunctivitis. Additionally, there is neonatal and congenital conjunctivitis, which are quite different to the adult forms, so I won't be going into that today. So just to summarize, I'll be going over viral, bacterial, and allergic conjunctivitis. So starting off with viral conjunctivitis, this is usually caused by the adenovirus, which also causes the common cold. Some textbooks say that this is the most common type of conjunctivitis, and it presents as a red, watery, and gritty eye, and can progress to become bilateral. In addition, there are follicles present, which are small blister-like swellings on the interior surface of the inferior eyelid. Also, preauricular lymphadenopathy can be present. So the main things to take away are the watery discharge, the follicles, and the preauricular lymphadenopathy, which are suggestive of viral conjunctivitis. Additionally, some patients can present with a history of a cold as well, which points towards a viral cause. Some patients may have photophobia or reduced acuity, which should always increase the suspicion of keratitis. So the main investigation of viral conjunctivitis is the conjunctival swab, and treatment is mostly supportive, which include artificial tears, and also antibiotics to prevent secondary infection. In addition to this, doctors should give general hygiene advice, and this is to prevent the spread of adenovirus. If keratitis is suspected, then topical steroids should be prescribed, although bacterial involvement should be carefully excluded. So moving on to bacterial conjunctivitis, this is a bit more diverse than viral conjunctivitis, and the causative organisms include Staphylococcus epidermidis, Staphylococcus aureus, Streptococcus pneumoniae, and Haemophilus influenza. The presenting clinical features are red, gritty, and sticky eyes. The stickiness is caused by the mucopurulent discharge, which can also cause some crusting of the eyelids. In addition, papillae can be present, and these are larger fleshier swellings on the inside of the eyelid than the follicles mentioned in the viral conjunctivitis. The main investigations are, the conjunctival swabs, although these are reserved for only really severe cases. Otherwise, you can move straight on to treatment. And this is using topical antibiotics, which, for example, are chloramphenicol or sodium fusidate. And there are also some other types of topical antibiotics that can be used. Now, this is the last type of conjunctivitis, which is the allergic conjunctivitis. And this is caused by type 1 hypersensitivity reaction to airborne allergens. And these can be seasonal, such as grass, tree, or weed pollen, or perennial, which such as the house dust mite. The clinical features are diffuse redness, which is in common with all the types of conjunctivitis, and there can be some lid and conjunctival edema, itching, watery discharge, and there may be a history of atopy or allergies. So the lid and conjunctival edema, the itching, the watery discharge, and the history of atopy or allergies really point towards allergic cause. For the investigations, you can consider allergy testing or conjunctival swabs if the diagnosis is in doubt. Otherwise, move straight on to treatment, which is mainly avoidance of allergens. And in cases of mild allergic conjunctivitis, artificial tears can be prescribed, and this is to dilute the allergen. In moderate cases, antihistamine, such as azolastine, or mast cell stabilizers, such as sodium chromoglycate, can be used. In severe cases, steroids can be prescribed and a referral should be made for a clinical immunologist. So that was a whistle-stop tour through conjunctivitis, and we covered the viral, bacterial, and allergic causes, and some ways to differentiate between the types. I hope you learned something from this podcast, and I'll see you again.